good evening. You're with Channel I and this is iMed. We're about to begin a brand new episode on today's iMed program as well. Now, last week we did discuss about a disease which is not given the attention that it needs, and sometimes if we are not careful, we might get it back. So, we did invite Dr. Pubudu Chulasiri. He is the community consultant physician at the anti-malaria campaign of Sri Lanka. So, welcome back, Doctor. A very good evening.
Good evening, Sanal.
Well, now, without any further ado, let's get right on with the questions. Now, first up, I have to ask you, whenever a malaria case is found, what is the procedure like? Because there should be some sort of procedure when a malaria patient in Sri Lanka is identified. For example, the diagnosis ways, the treatment, the follow-up, or the activities done to prevent the spread to others, because that's very important.
Yes, Sonal. Whenever we get, especially the imported, now last week also I told you that now we get imported cases. Whenever we get imported cases, there are lots of things to do. Not only the diagnosis and treatment, because we need to follow them up for a certain period of time. And as you correctly said, we have to prevent it further spreading. So, for that there are several activities what we have to do. Parasitological surveillance, which means that we want to know whether it has spread to the others, and we are going to find whether the parasite is there in the other people. Also, we are going to find out whether any mosquito who are responsible for the spreading of disease. So, we are doing entomological surveillance, and also if the mosquitoes are there, we do some control activities, we call them vector control, and also we do some the public awareness programs on these patients. So, I will start from the diagnosis and treatment. Actually, people, most of the people come with the fever, general features of malaria, fever, headache, body aches, like those things. So, it's really hard to diagnose the patient only with their history. So, in the history, the most important thing to elicit from the patient is whether they have been to a country where the malaria is there, especially for the African countries. So, that is the most important thing. So, if any doctors are with us, please please ask from your patient that whether that patient has visited to any malaria endemic country. So, diagnosis, what we do from the microscopy, mean we get the blood from that person who is having features of malaria like fever and other features, and we do inspect that through a microscope. So, we have this staff we call laboratory technicians in almost all the hospitals in Sri Lanka. So, if they want to get it diagnosed, they can come either to a hospital or a office, which we call the regional malaria office in each district. So, they can come there and get the testing done. But there may be some instances where they can't come, especially if they are very far from the hospital. But we have given some kits, we call them rapid diagnostic kits, to many general practitioners and very small hospitals even. Then within 25 minutes they can get tested malaria and get confirmation of malaria.
I think, Doctor, there are a lot of similarities when it comes to the procedure of identifying a malaria patient and the necessary procedures to the COVID-19 procedures as well. Yeah. Now, you stated there is an RDT kit, yeah, a rapid diagnostic kit. We did have the rapid antigen test. So, what are the similarities between the two?
You mean testings?
Testing.
Yeah, testings mean here we need to get some blood. This for that rapid diagnostic kit, there is 2 wells. For one well we have to put that there is a buffer solution, and for the other one we have to put the finger prick, 1 droplet of blood, and then we get some kind of bands and based on the band we can decide whether what kind of disease, whether it is Plasmodium falciparum, whether it is Plasmodium vivax, the type of parasites, because zoonotic type of parasite is very important in our management.
So your treatment changes if the parasite breed is different?
Yeah. So treatment in the sense, whenever we diagnose, then the patient should be admitted to a hospital, that is compulsory, and he should be treated for 3 days and he should be followed up for 1 year, almost 1 year, to check whether we have destroyed all the parasites inside their body. That's why we are following them up for a certain period of time.
Okay. Now, if you actually search about the disease of malaria, you might come across this acronym called POR. So if I abbreviate that for you, that's prevention of reintroduction. Now, what is the meaning of prevention of reintroduction, this POR acronym, and what are the current steps taken in Sri Lanka to prevent malaria, the current steps?
Yeah. As I told you last week, now we eliminated malaria in 2012. So World Health Organization declared Sri Lanka as malaria eliminated country in 2016. Before that we were in elimination phase. But after the elimination, what we want to do is we want to prevent getting any cases, any indigenous cases. So now from 2016 we are in the phase of prevention of reintroduction. We are to prevent getting any cases, indigenous cases, prevention of reintroduction. That is POR. It's very, very difficult to maintain that POR phase. Why? Because here, look at those slides. Here. Before the elimination, actually, in as I told earlier, in 1916 also we were in the verge of elimination. But from the 5 million cases, we got almost 17 cases. But with some kind of issues, we again got cases. But you may be seeing that again we are experiencing the same situation. So elimination, yeah, we have done it. But then prevention, because we have to do lots of awareness, especially among for the doctors and for the public on getting malaria again, because there are lots of things that we can do, especially when we are talking about prevention of malaria. Yeah, because we have to target them, specific risk groups, especially the trifosas and people going to this malaria endemic country. There are very good method of prevention. One is chemoprophylaxis, giving drugs, because we are having some drugs, very successful drugs, to prevent getting the disease, the parasite inside their body. So if they take them accordingly as our advice, mostly they won't get the disease. And even after coming, even though they get the disease, but if they come to the doctor early after they get these symptoms, and if they say within last 1 year I have been to this country and this may be malaria, doctor, please check it. So if they say to a doctor, then it's very easy as to diagnose and manage. So the challenges in sales, most people do not declare that to the staff, and even the because malaria is now forgotten, because you might have not heard it, no? Yeah, because this is same to the others even, especially some young doctors, they have not seen any patients in their service period, so they can't remember the exact things that they have to ask. So that is why the prevention is very difficult, but we are very successful in prevention of any introduction.
I think the younger generation has heard of the term malaria, but I don't think they have come across any patients or have been exposed to the disease, doctor, because I think in 2016 the WHO issued the certificate, malaria-free certificate to Sri Lanka, and I think that's why the younger generation have heard of the term but have not been exposed.
Yeah, because especially there are some researchers, especially surveys, demographic health surveys done in I think 2016.
Yes.
So here, but the one question they asked from the population is whether you know that malaria is eliminated from Sri Lanka.
Awareness.
Awareness. Around I think 68% said that they know that malaria has been eliminated from Sri Lanka. So yes, I do agree that they know, they have heard, but whenever they come to this situation, the doctor-patient relationship, sometimes they tend to forget that.
Now, I'm about to move on to a more complex but a very important question in these times. So, when the general public, when they're traveling abroad and say returning to Sri Lanka, both ways, what should they follow? What is the procedure like if they're traveling to a malaria endemic country?
Yeah, because now those are their planned visits, Sonar. Planned visits in the sense they know that they are going there. So as I told earlier, they can get chemoprophylaxis and preventive medicine from either malaria headquarters or regional officers, and also they can get bitten by the mosquito from these countries. Staying under the bed net in nights, that is one of the good method to prevent mosquito biting. That is one thing. And I want to tell these general public who are going to these countries, when they come to Sri Lanka again, whenever they get fever, and if they came within last 1 year, please tell it to a doctor that you visited the country and this could be malaria. Then all the other parts will be done by the malaria campaign. So that is the major the most important message that we have to give to the general public as well as health staff.
Okay, now I did mention at the beginning, Doctor, you work for the anti-malaria campaign of Sri Lanka. Now, other than managing malaria cases in Sri Lanka, what are the other activities done by the malaria control program?
Yeah, that is whenever we get a patient, but don't think that we act only when the cases are there. So there are lots of activities, because we proactively we do some programs to identify whether there are any patient who are not showing any features of malaria. So we do proactive entomological and parasitological surveillance. We go to the risk groups who are working, because sometimes in some areas there are people from these countries are working there. So we go to these places and we randomly select some people and check their blood whether there are any missing parasites inside their body. And also routinely we do check for mosquitoes, see their behavior, to sometimes to forecast whether there will be an outbreak or not. So entomological surveillance also will be done, proactive entomological surveillance also will be done to identify whether there is a risk of outbreak in the future. That is other thing. And awareness, public awareness, we are doing many clinician training programs and other programs. But those are, I am not saying these are not all methods, but those are conventional methods. Then recently we have introduced some novel methods. So especially the theme of this year, Malaria Day, harnessing of novel
harnessing innovation to get rid of malaria.
So the concept of Dr. Prasad Ranavira is the director of anti-malaria campaign. We initiate some social media campaign. Social media campaign actually,
if you look at
the slide, is on promise. So promise means prevent re-establishment of malaria in Sri Lanka. PROMIS. So that means through the Facebook, through other methods of social media campaigns, we give these many messages through some experts in health, consultants, and through some leading figures like actors, singers, and
so
through
people who can have an influence on the people.
Definitely influence. Through them we just share our knowledge and our messages to the general public, it is very, very successful, because now almost all the children, adolescents, adults, they are having smartphones with these apps, no, Facebook apps and other apps. So this is a very good method, and we have achieved a lot, because now we with these post surveillances, we get to know that now it has been gone to these people well.
The message has been passed.
Message has been passed.
Okay, I think using social media is something very innovative and very effective as well in the digital era.
Definitely.
So kudos for you for that. And well, we are heading towards the latter part of the program as well. Now, if you have any advice to give to the medical community out there, say for example doctors or nurses or people who are trying to get rid of malaria, what is your advice for them?
Yeah. The most important message is, whenever a person comes to you with with features of malaria, please ask them travel history, because mostly the person may show the features which is similar to the dengue fever. So if you don't ask this travel history, so you will miss these cases. So, and also their platelet count also decreasing from either malaria or dengue. So don't just focus only for the dengue fever, just get the travel history, whether they have been to a malaria endemic country, and refer them to a diagnosis for the confirmation. That is the most important thing. So refer them, and then we have very good drugs, very good treatments which we can cure them 100%.
Now, as you mentioned before, doctor, you said the younger generation does not have the exposition to the malaria disease.
Yeah.
So the doctors who are graduating now, they should be aware more than anyone.
Definitely, because they are the one who has not exposed to any malaria cases in their undergraduate training period. So but we are giving awareness for these doctors, especially the pre-interns also, and but the most important thing is that travel history.
Okay, and if you have any advice towards the general public who, or the laymen out there who are watching today's show?
Yeah, if you are traveling from one place to another place in Sri Lanka, don't worry about malaria. So you don't need to worry about malaria. But if you travel to a country where the malaria is there, either to African countries or to South American countries or Southeast region, please get some preventive medicines, and even after coming, if you get features of malaria, especially fever, please declare your travel history to a first contact doctor and get the testing done.
Okay, I think that was some good advice that the layman out there or the general public out there should concern themselves with. Now, that was the penultimate question, doctor. The ultimate question. I did mention that we celebrated the World Malaria Day. We celebrate the World Malaria Day every year on April 25th. Now, what is your message to the general public regarding the World Malaria Day?
Yeah. Because World Malaria is Day for the entire world, not only Sri Lanka. So usually this year we celebrated, and our theme was mainly we focused on vaccination for malaria. But in Sri Lanka we don't need vaccination. So my main message to you, especially for the general public, is yes, don't have unnecessary fear on malaria, because we frequently get malaria cases. We have very good facilities to diagnose and treat malaria, but it happens only when you declare your true travel history only.
So that was the message from the doctor about the World Malaria Day and how it should be commemorated. And again, note this point, you have to mention your travel history to the doctors. That's like a big plus point plus point in today's segment. So with that, we have to wind up today's segment. And yes, we had with us the consultant community physician of the anti-malaria campaign of Sri Lanka, Dr. Pubudu Chulasiri, here with us. And thank you so much for being here, Doctor, and amidst your busy schedule, and in an attempt to educate the public, enlighten our audience about the disease of malaria.
Thank you, Sonal. Actually, this is a very good opportunity to the anti-malaria campaign to increase the awareness of the general public as well as health staff on malaria. So, thank you very much, you and the Sri Lanka Rupavahini Corporation, for this chance.
Our pleasure having you here, sir. So, with that, we wind up today's segment of iMed. Do join us next week for a different topic, different disease, and the ways you can help eliminate them from Sri Lanka. So, with that, we say bye, and until then, until next week, stay safe. A very good night. If you look at this slide.